Comeback mobility performs three-dimensional modeling based on CT scan data and finite element analysis to determine the optimal weight bearing for patients with lower limb fractures. This allows for modeling micromovements of bone fragments and objectively determining which load will lead to internal fixation failure or dangerous displacement of bone fragments, as well as which load will improve the properties of the callus during the remodeling phase. Based on these calculations, surgeons and physiotherapists decide what percentage of body weight patients should transfer to the recovering limb and prescribe individualized weight-bearing programs. Let's consider an example of a 39-year-old man with a body mass index of 22.6 after a comminuted fracture of the distal third of the tibia. The fracture was stabilized using a medial plate and 7 screws. The modeling revealed 3 important aspects to consider when prescribing weight-bearing program. First, the interfragmentary movement in the fracture zone with 1 millimeters is achieved at a weight bearing of 60 kilograms or 80% of the patient's body weight. Second, at a weight bearing of 11.13 kilograms or 16% of the patient's body weight, destroying the cancellous part of the distal epiphysis of the tibia in the contact area with the cortical bone fragment is possible. And the third aspect, one of the screws is very likely to loosen and become unstable during walking, even at a weight bearing of 7.5 kilograms, which corresponds to 10% of the patient's body weight. We clearly see the unstable fixation of this screw with the plate during load segmentation and modeling. It is subject to significant bending loads resulting from the torque between the bone fragments during compression. Conclusion, based on the obtained data, it can be assumed with a high degree of probability that the internal fixation during walking, even with a minimal weight bearing of 10% of the patient's body weight, will be unstable due to the screw instability.